Hello, good evening, everybody. I'm Dr. Cheranteja Koganti. I'm a consultant neuropsychiatrist. I'm working with Kim's Hospital's Kondapur branch in Hyderabad. I also make videos that help destigmatize mental health. So I started this series called Midweek's Mental Health somewhere in the beginning of the pandemic. It's been a good 9 months, and today we are going to be having a last video for this year. I mean, probably I'll be coming with more videos next year. So today we are on episode 30 with a really special guest. Let's wait for her. She's Dr. Manjula Anagani. She's a consultant gynecologist and obstetrician. Today's topic is menopause and mental health. We're going to talk a lot about what does menopause do to women, and what is menopause, and how does it affect a woman's mental health. You can definitely help your mothers or grandparents who are nearing menopause or have had menopause with the information. Probably you can translate them to Telugu or whatever. You can help by watching this video. Meanwhile, if you have any questions about menopause, please feel free to post on the comment section. Me and Dr. Manjula will be able to address them during the live or by the end of the live. Yes. Hello. Yes, I speak Telugu. That's my mother tongue. Yes. Hi, ma'am. Ma'am's here. Let's just try to get ma'am on live.
Hi.
Ma'am, how are you?
I'm good, Charan. How are you?
I'm good, ma'am. I'm good. I'm very excited.
Yeah, hopefully this is going to be a different session from the regular ones, which is a common one, but yeah, we'll see how it goes. Yeah, tell me, Charan.
Firstly, I'm super proud of you, of the work that you're doing online, and you're really educating and helping a lot of women across all age groups. Super proud of you. And also, congratulations on your Padmashree. That's a big one.
Thank you, Charan. Yeah, tell me.
Ma'am, I want you to introduce yourself, ma'am. Tell everyone, what do you do? What are the different works you do?
I'm Dr. Manjula Anagani. I'm a gynecologist, laparoscopic surgeon. That's the only thing, but my passion is to teach. That is something which is very important. So teaching means it is to not just do yourself. Learning is not one thing. For me, there are 6 sutras actually for the research. One is definitely getting trained properly. That is what is important before you do anything. And then when you're doing something, when you're trained, take your technique forward. And technology is something which keeps changing and which we have to upgrade ourselves. And then what you teach, what you do, you have something which you have to share with your next generation. It should not stop with you. So that's where it comes. And then finally, if your temperament is not good, nothing is going to, whatever you're going to do is not going to achieve. But on the top of the whole thing is the teamwork. It's never I, me, myself, Irene. It doesn't work like that. So it has to be the team, that is what is very, very important. Otherwise, you are the ones like, we have to end up with people like you because we will be burned out then. So we are not interested in that, then definitely it has to be that teamwork. So I believe in this. Yes, the corona has given us a different thing where we can do other things. See, for me, prevention is something which we all talk about, Charan, about prevention is better than cure, better than cure. But how far, when we started thinking of prevention, it is individually you or me or something which we cannot reach out to many people. So that's when we need the help of the media a lot. Media, when we say media, that's when my help came in the form of media, either in the TV or print, and the digital came in the recent times. So when it comes to the digital has come, it takes time, but it will reach out to people. But as such, media has to do it. So it either government has to do something, or media has to do something, or individually person. even if we can achieve little bit of change in the people and the perception, I think we have achieved it, our thing. That is
Yeah,
what I feel. That's it.
yeah,
My
yeah.
profession is passion. That's it.
How fortunate are people like us, ma'am, who are also passionate about the profession, not
That's
just
true.
doing it for the heck of it.
That's
Yeah,
true.
yeah. Ma'am, so I thought about this interesting topic because a lot of people think women's lifespan is only between menarche and menopause. So they
Mm.
equate women to the reproductive age group. But
Right.
lot of women are also having premature menopause and post hysterectomy. Um,
Right.
so I want people to understand what menopause is. What is menopause, ma'am?
Right. People usually used to think, like you said, menopause is a time when, everything useless. It's like
Mm,
putting it aside. But like you said, 1/3 of our life we are spending in menopause. So we better understand what a new life, the new beginnings. It's a beginning of a new beginnings. That is what I would like to say. But if you take it harmoniously and if you take it physiologically, if the ovaries stop functioning, it's nothing to do with menstrual cycle, nothing to do with reproductive action, nothing. But if the ovaries stop functioning for at least a year, means a 12 months of menstrual cycle being absent because of ovarian function being lost, that is what is menopause. So it is not one day thing. It is pre-menopause, post, and whole of our life, whether it is like you said, if the woman undergoes a premature menopause at 35, 40, means if she's alive till 80, half of her life she's in menopause. So she better understand to improve the quality of life in that age. But Charan, very interestingly, when you said that a lot of women are undergoing premature menopause, I think primary ovarian failures are also something which we are seeing quite a bit in nowadays. 18, 20-year-old girls with primary ovarian failures. So
yeah,
they are equal to menopause. I
yeah,
think we should be targeting those people also.
yeah, yeah. So basically, this whatever we're going to be sharing
Mm.
applies for every woman.
Yes, yes.
Yeah,
If
yeah,
not today, it is for tomorrow.
yeah, yeah. I mean, with increase in life expectancy, not
Right.
1/3, ma'am, more than 1/3 of life people can be
Life is
spent
there.
in
True.
menopause. Yeah,
True.
ma'am. What is the usual onset? What age does a woman attain menopause?
See, normally 45 to 55 is the age when we see depend all over the world. But in India, very funnily, initially when we were studying in PG, it used to be 52.3. Now it has come down to 42.8. So that means menopausal age group is actually coming down. It's either because of environmental issues or because of the stress we are undergoing or because of the fertility treatments utilizing all the eggs. We really don't know. So many factors, cofactors, where we are seeing menopause in the early age group. Saying that if we say premenopause or early menopause, we can tell it between 40 to 45. Premature menopause, we can call them this less than 40 years. So if a woman in 42 starts expecting, that only shows that she's going to be nearer to the menopause. So we have to understand, like we said, life expectancy of India is at least 70 years if we take it.
Yeah,
And
yeah,
45 plus 25, that is more than 1/3, like you said, Charan, are in menopausal age group.
yeah,
So, and that is the time when we all have time. We finished our work, our responsibilities. So I think, like I said, it has to be the time for new beginnings and they have to start thinking of what else can be done in the productive 1/3 of life.
yeah. I tell all my patients, like they say that my life is over. I
Oh,
attend
I
menopause
know, very
also.
funny.
I tell them, no, this is your beginning. This is when you're going to be actually living. Your second chances is this.
Yes, true, true.
Yeah,
Absolutely. One third of the life, first, when we say premarital or whatever it is, we have been listening to the parents and studying and studying and studying and studying. Next 1/3 is the production and then taking care of the kids and kids and kids and settling them. Actual time to yourself, where you put yourself as priority, is this time. When you actually look down upon and say, what did I do to myself? What happened to my skin? What happened to my opacity? What happened to my hair? I have lots of time to what to do now. I think the me time comes only in menopause.
yeah. I mean, yeah. Me starts with like menopause. Yeah, yeah. That is superb, ma'am. Ma'am, but like, how does one recognize that they have
Actually, I
attained
think
menopause?
that we can actually make it as me,
Yeah,
no pause.
yeah,
Me,
yeah,
no
yeah,
pause.
yeah.
Okay?
That sounds very cool, actually. That
Yeah.
that 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 re- that that.
Somebody, when I posted this, Mr. Krishnavamsi was telling, Doctor, you put menopause. Does it mean that it's something to do with men? I said, no, men make it more worse. So it is me. the way
I
we
mean,
look.
that's another way of saying that, I'm unstoppable.
Yes, we are not stoppable. Women is not stoppable. So menopause is the thing.
No, no, no. I'm
Yeah,
with you on that one. Yeah.
yeah.
So, ma'am, what are the symptoms of like around menopause? Like, how does one recognize that they're attaining menopause?
Yeah. So I first, when there is a see, when we say menopause or any reproductive age group, we always relate to menstrual cycles. So when the menstrual cycles start becoming irregular, either less frequency or less quantity or more, it can be either ways. It can be more frequent, more bleeding. That's when they actually come to us. That is the first symptom with which they come to us. The second common symptom which we see is hot flushes and increased sweating in the night. Third, again, premenstrual syndrome merging with perimenopausal syndrome, where they'll start having this depression, mood swings, and then mostly the anger streaks which they start coming and shouting at people and everything. They themselves realize that, and they don't want to do something about it. And lastly but not least is the sexual life, which is completely getting screwed because of the dryness of the vagina, recurrent urinary infections, recurrent vaginal infections. These are the usual thing which comes. But if we actually go into depth of it and we ask patients, we start with V, that is vaginal atrophy, and the dryness and the whole gamut of things, which dyspareunia and everything which comes with it. The second one will be the autonomic dysfunction, where you start having hot flushes and then muscular pains and completely the heart racing, palpitations and all those things. And then the psychological issues of mood swings, depressions, and then premenstrual syndrome, and then urinary symptoms like frequency increased, or even night urge incontinence, which is increasing, or recurrent urinary tract infections. But late ones, which we come, these are the common things which we see, that is muscular pains and all. But late also, we should not forget the effect on the bone, that is the bone pains, muscle pains, osteoporosis effect on the heart, effect on the brain. These are things usually have. And finally, the incidence of cancers, because that is natural to see in that age group, which we, whenever anything comes, we start associating and start evaluating for cancers. So that's what it has to be.
Yeah, yeah. Ma'am, someone asked if they can prevent hot flashes. What can they do if they have hot flashes?
Let me tell you one thing. Prevention is something that is menopausal. When we know it is because of that, how can we control it is what we are going to see. We cannot prevent menopause. Menopause is doomed to happen. Means the FSH is going to... FSH is a reflection of ovarian function. Okay. If ovaries stop functioning, we see FSH. So how do we diagnose? If somebody do not have menstrual cycle for more than a year, and then you have FSH more than 30. These are the usual tests which we do. Nowadays, people do AMH also to know when it starts and all that. So if FSH starts increasing more than 10, in itself, we know that this is nearby. Menopause is going to come nearby. But then if the hot flashes come, what do you do? So we know we can avoid the hot environment, start using cold water for doing this, and switch over to completely cotton things. And then AC. All these things will go a long way. And calcium deficiency, if it is starting supplements of calcium, vitamin D, magnesium, that go a long way in these things. So if you do all this and still it doesn't come down, you don't have to worry. Just meet the gynecologist. These are all because of the autonomic dysfunction. Since it is because of the autonomic dysfunction which comes with it, we just start something like gabapentin or paroxetine, which SSRIs can be started. This will really help in the hot flushes. So we are not going to give you any hormone where you go with this. So relax about it. Just go, but use the regular things like changing into cool surfaces, everything cool, keeping the areas cool, seeing that you have cotton bed sheets, cotton linen cloths, cotton cloths. Don't wear synthetic ones, and cold water. These go a long way in controlling the hot flushes and even the night sweats. Night sweats can really come down once the calcium is added.
So calcium is also you can increase the dietary supplementation of calcium.
Yeah.
A lot of people don't eat like curd, milk, like it's eliminated out of their life.
But then we have to understand curd is also pre-probiotic, which is very, very essential in today's time where a GI tract. Most of the problems which we have is because of the GI tract things induced things. So curd, at least, I think our olden grandmothers, grandparents started inculcating us to give that. So we got so used that we got bored maybe. But if you don't want curd, go to yogurt. If you want to make it little different and eat. But please do take curd. That goes a long way in your acidity, in your pre-probiotic and effective absorption, and also calcium. Please remember that.
Yeah. talking about calcium, and the next question is related, ma'am. Does menopause cause bone loss, and what can we do?
Right. See, what we have to understand is that I always tell my patients, if you equate your bone to a teak wood, okay, it's like that. And with menopause, the inside becomes kokla, means the inside will be moth eaten. So it becomes like a bamboo shoot. It might look beautiful from outside, but inside is nothing. So we need our bones to be like teak, which will not break, but not like bamboo, which will break. So what happens? We need something which will see, calcium is the mineral. Okay, the mineral doesn't go into the bone just because we take calcium. We need a vehicle to take the calcium into the bone. That is estrogen. Now with menopause, estrogen is lost. So calcium is not going into the bones. So that is the reason we need a bone bank, which is done when you are young. Means when you are in 10th class, 11th class, when we take adequate calcium and calcium supplements at from the age of 40, still when the estrogen is there.
Yeah.
See, what I'm trying to tell you is, as long as estrogen is there, it will take the calcium and keep the bone bank adequate. If your estrogen, you're not taking calcium supplements and your bone bank is not adequate, once the estrogen is gone, it starts like osteoclastic activities, which is there. It's always a balance between osteoblastic activity and osteoclastic activity. Means it's the formation and the loss. And the loss, then what do we do if there is completely loss? Then we give bisphosphonates, which will stop the bone from getting osteoclastic. So how do we improve the bone strength? Either you give estrogen so that the calcium is gone, or you give bisphosphonates to stop the calcium from going out of the bone. So if we just understand that, I'm taking calcium, still I'm having bone pains. You are taking calcium, but it is late. Don't start it late. Start from 40 years. Start improving your bone strength and bone bank to be ready so that when you're using it, it is still there inside your bones. That is what is more important for you. So estrogen, calcium, if necessary, bisphosphonates, and vitamin D. Don't forget vitamin D. These are all very, very essential. But for muscle, it is vitamin E and magnesium also, which goes a long way.
Yeah. So at 40, you're not supposed to just look at your bank balance, but also at your bone bank.
Bone bank is very important. Health bank is most important. I don't know why people are behind this that bank. Bank बोले तो उन लोगों को वही समझ में आता, बाकी सब कुछ समझ में नहीं आता.
Ma'am, what about heart disease? Menopause and risk of heart diseases.
Like I said, long-term effects, when we say, it's all related to hormones. There's a very interesting question. People always get worried. Hormones. It is like, as if we are giving some poison. That's the way they behave. They're so scared of hormones. But which human being is alive without hormones? Just give me one person who is not having thyroid, who is not having insulin, who is not having adrenaline rush, who is not having estrogen, progesterone, testosterone. All are hormones. What we need to understand is that there is a balance which God wants us to have. And the balance is very, very important. And it is not the imbalance. We are not here to live with imbalance. So when we are looking at it, for a purpose the estrogen is given, estrogen there is something called lipid profile, which everybody knows. We all talk about lipid profile, cholesterol ఎక్కువైంది, cholesterol తక్కువైంది, cholesterol. So this is what they keep talking. So in cholesterol, there is good cholesterol, there is bad cholesterol. Good cholesterol is nothing but HDL. Okay, that HDL is there in that level only because of estrogen. You will never see a young 25-year-old girl getting heart attack. Unless there is primary ovarian failure, premature ovarian failure, or we did some ovaries we are removed. But you will see a 25-year-old boy getting heart attacks. Okay? Because the estrogen is protecting that. The HDL is the one which protects the heart from getting heart attack. But once the estrogen is gone after menopause, the HDL starts coming down, then the balance is again gone. So heart attack rates start increasing. So it is not the menopause which is increasing. It is equating to them that of the men. We are almost becoming like men. So it is not increasing, but we have been lucky to be protected by this. That is what happens. So long-term effects, when we talk about effect on the heart, effect on the bones, and effect on including strokes also. They also increase. So when we talk about all this, so if necessary, we do give low dose estrogen depending on the symptoms. If the patient is having symptoms, we definitely give you estrogen at the level where it is balance can be maintained and at the level which does not cause side effects. That is what is important. Don't get scared. Be under the gynecologist's supervision. Take the hormones. Then you can have a quality of life for the next 20, 30 years in the menopause, which is needed. They can have a normal sexual life. They can have normal bones and bone bank being there. Your skin will be glowing again. I mean, you don't need to have the wrinkles and everything, where the dryness of the skin and everything. And your hair loss can be controlled. Your memory will be normal almost. Your depression, mood swings will be all right. See, women have less Alzheimer's than men because of estrogen again. So the effect of estrogen is on every tissue. For a woman, we are lucky to be women.
Ma'am, you just mentioned about sexual problems, ma'am. What are the common sexual problems that occur because a lot of patients do come to me with the intimacy issues where the husband and wife are falling apart because, husband has the drive and woman doesn't want to do it.
First is the libido, which is less, like you said. See, what we have to understand from ovaries is testosterone is the hormone for libido. We all agree. But progesterone, estrogen, and from the stroma, there is a testosterone which is released, even androgen which is released for women. Androgen releases even till 54 years for women, even after menopause. The libido comes down. The DHEAS, which we call it as dihydroepiandrosterone sulfate, which comes from the adrenaline and from the adrenal glands and the ovaries, are the ones which causes the drive. So once the drive comes down, that is the first thing. Second thing is the dryness. The drive even more comes down because of dyspareunia. Once the pain is there, that decreases the drive. The libido comes down. Then you have the tissue becomes so atrophic and thin that it starts splitting. So there will be recurrent infections. The infections again leads to decreased libido, dyspareunia, everything. It's a vicious cycle. So instead of suffering, they should go to the gynecologist, take the local treatment, have a normal sexual life. See, both of them are having enough time after that time. They are not worried about children. They both are going to live separately. That's when he is retired. He might be retired. He might be working also. She also might be working and all that. I don't know. That's a wrong thing to say anyway. So when they want a normal life, I think that is your life. You should not be worried about what others do and everything. I listen to this very clearly when a woman comes and says, even at this age, my husband wants, what is it now? It's like as if their life is gone and everything. So I think people have to understand that, no, that is a norm. Worldwide, we do see people getting married at those ages. So I don't think we should go back to our age-old things where we think that after 40, the woman's life is over, or after 50, man's life is only to take care of the whole thing. So they should be thinking of themselves too and take care of their normal sexual life. That is very, very important. And there are treatments. You can be having local treatments, if necessary, hormonal treatments to improve the libido. We do have pentoxyphilins if necessary, or even androgen injections. Even for women, we do give to decrease if they have to increase the libido. So there are so many things which are available now. So they have to understand, talk to the right person. That is what is important.
Yeah, when I tell the patients that, there are treatment options, they say like, oh, why do I need to care about sex at this age? Let it be now.
That's the thing. Yeah.
So I tell them this is the age. Sex is not about like sex. It's more about companionship and feeling of belongingness. Maybe this is the age you should be concentrating it on. Because still now it's more mechanical, right? You wanted to have a child before 30, right? And then you bring up the child. And now is the time you need to, have companionship and self-time.
And this lack of sexual drive or normal intimacy should not be the reason for the couple to separate. That can be cured. That is what is very, very important.
I mean, that is actually an important reason why they separate, or why
infidelity. It leads to more problems.
Infidelity, they would cheat on each other. And
one is infidelity, and then they start having this. They might not say this is the reason, but then they start searching for other reasons, and they start fighting and bickering. Everything starts, it can be the reason, the birth of the other problems.
Ma'am, also body image issues, right? We just spoke about intimacy. What about the body image issues? Because women's body tend to change. What are the changes that occur in the body?
See, one thing we have to understand, like I said, estrogen and this thing, the basic metabolic rate comes down first. So you tend to put on weight, and the androgen, which is like I said, till 54th androgen comes, whereas it's going to go. So they're going to have more of a androgen type of body figure, in the sense abdomen that starts increasing, and then your how much ever you do exercise, you would not be losing weight. So the dysmorphic this thing about themselves starts happening. So they have the body shame happening, and then the dietary thing has to come down automatically. These 400 to 500 kilocalories, they have to stop, decrease their intake at this time. You cannot stop. I used to take the same amount. Now also I'm taking the same amount. No, because your basic BMR, basic metabolic rate is going to come down. Whatever you eat is not going to be cut down into calories, and extra calories are going to put on weight. And this time it is going to be put on around your abdominal girth. So your abdominal waist to thigh circumference ratio is going to be worse, and you're going to go into obesity side. So I have people and who come to me at this age saying that we want to undergo some plastic surgery thing. And there again, they think that what will others say? I think they should not worry about what others say. There's another thing which will happen at the time is sagging of the breasts. Okay, because of again estrogen, there will be sagging of the breast. It is your body. It is your thing. It is your relationship with your husband. So there are people who go for breast reconstruction. They go for abdominoplasty at this age. They go for second honeymoon out to another trip anywhere in the world, and they really resurrect their life. I think they should get it, and they should look at themselves. Like priority should be given to them at this time.
Yeah, I mean, I'm completely with you on that, ma'am. A lot of people ignore how the body looks, and taking care of self physically and mentally is so important, at this age.
Much positive body image, Sharon, automatically gives you a lot of self-confidence, and that itself will help in the mental health also.
Yeah. I mean, sagging breast post-menopause is a big problem. Actually, a lot of people who come with intimacy problems are not because of lack of libido, but because how man is finding unattractive about a wife, and wife is also uncomfortable bearing herself in front of a man.
Right. I think these things which they have to ask themselves, talk to the doctor, get solutions, because the solutions are there. It's not that we don't have solutions. Then they should not feel this about this something wrong about the solutions.
Yeah.
And it is their health, their choices are theirs. They don't have to discuss with anybody else. And if the husband and wife are comfortable and confident about the decisions they take, they should talk to the doctor and go ahead with that.
Yeah, I don't think so. They need to even advocate with their children, because it's a decision between both of them. Children would find it very odd, and they'll say like, "Why do you care to do all this now?"
I have a patient. I've had a patient who they got their mother to undergo a vaginal reconstruction surgery, and the prolapse surgeries to be normal, to be feeling normal. That is, the generation is changing, so that's fine. That's good.
That's fantastic, actually. I mean, I hope we have more sons like that, like who would like really care about their parents like that.
Got it.
Ma'am, I think we pretty much covered all the topics.
Yeah.
But ma'am, any general tips for a perimenopausal woman?
I think what I would definitely say is, after 40 years, please remember, get your regular pap smears done, and get your mammogram 40 years of 2 years, 3 years, please get it done. That is very, very important. Depending on that, till 55 years, then we'll see. Then what self-breast examination is very, very mandatory, and get your self-examined by a gynecologist at least once in 6 months or even. And make your gynecologist your close friend, so that you can discuss all your problems with her, because it's a doctor-patient privilege. She will not talk, she or he will not talk outside. That is something which you can relate to and talk to them very, very clearly. Next, calcium supplements should be started at 40 years of age, and don't get confused between medication supplements and the replacements. Supplements means what your body should be producing, she needs it, and which does not produce. So you give multivitamins or iron or anything. Whereas when it comes to the medication, if there's a disease and you take maybe 5 days for throat infection or anything like that, when it's replacement, your body is supposed to produce and not producing adequately, then you replace, like estrogen or thyroid or insulin, whatever. So you understand the difference. Replacements need to be taken every day. So don't get paranoid. Do I have to take every medication is till the disease lasts, and supplements here, menopause, calcium, magnesium, you need to take from 40 years of age. And later, if you have any symptoms like hot flushes or anything, just meet the doctor and make a group between your husband, your doctor, and yourself, so that if you have anything, you can always have a group of friends who are all menopause. You can discuss what helps the other person in hot flushes might help you. You can try that also. So if you have a help for group, self group, help groups or anything, that also can be done. But one thing about menopausal thing I want to say is stop delaying going to the doctor till
Yeah.
they come to us in stage 4, stage 3, if there is malignancies which come. So don't do that. Just go meet them. If it's normal, it's normal. Don't worry, but just meet them. And even depressions, even mental health, even because there's an emptiness syndrome at that. That is the reason we are trying to tell about, both of us are trying to tell about the intimacy and making a friend of your husband, because emptiness syndrome and the increasing distances between the wife and the husband will lead to more psychological disorders in today's time, with loss of estrogen also. So there are solutions. Dr. Charan is sitting there. I am here. Many more gynecologists and psychiatrists are there out there. Don't get worried about going to a psychiatrist. You need. That is also a thing which is needed, and get the help. That is what I would like to say.
Yeah. And before we end, you wonderfully said about, self-help groups. Do we have any in India, ma'am? Because I think that would be a fantastic way to share with people.
Yeah, there are so many self-help groups when it comes to the moms, pregnancy, post-delivery. It's menopausal. I think people have started 1 or 2 on the social medias, and also they should be searching and then do it. But otherwise, they can have their own friends who are happy, and you can form a group. Go for exercise. One thing I want to say is at least 2 to 3 exercise is the most important thing if you want to lose weight, and aerobic sort of exercise. I'm not telling you to go onto the mountains and trekking and climb the mountain. No, don't break your bones. We don't want all that. Just a simple aerobic sort of thing, or dance in your room. Put some music and dance in your room. It will increase your flexibility and your joints and everything. All things, the bone pains, joint pains, and your muscle pains also will decrease. So exercise also will take you a long way.
Yeah, also exercise helps depression with the endorphin kick. That's a fantastic way. Yeah.
I always tell you, exercise means if you don't want to go, most of the time, again, body environment, they just don't go outside and they don't want to wear dresses and go and then do it. Okay, close your door. You imagine whichever heroine dance you like, you doing it. You want Junior NTR dance, do it. Allu Arjun dance. But do something where muscles are getting contracted. Close the door and do. That is good enough exercise. 3 dances, 3 songs. Enough.
Yeah. Or create your own dance move, your own special.
Nobody is seeing, but you're still doing, and you lose weight, then you can go out.
Even if people are watching, dance like no one's watching. That's what I believe in.
I agree, but this is for people who do not want to go.
Yeah, do not want. Yeah. All right, ma'am. I think that's our time. Fantastic conversation. I hope you had fun as well talking.
I'm seeing so many people are having fun, and they've been messaging. And just putting, it's a pleasure being here. Yeah.
Thank you so much, ma'am. Pleasure is all mine, and I would like to meet you sometime soon.
Absolutely. Okay.
Have a great, no more year ahead. Happy New Year, ma'am.
To everybody.
Okay. To everyone out there. Thank you so much, ma'am. Stay safe. Bye. So that is Dr. Manjula Anagani for us. I'm so happy that I'm ending this year with this conversation with her, and this is our 30th episode. It feels very strange to say for a doctor episode and all these things, but I hope all of you are having information that you need from these talks. And if you think anything else that we can talk in the next coming episodes, please feel free to comment or whatever. Sometimes I might not know what you need. I think I know, but maybe that's not true. So I'm here to help you. So just leave a text or drop a comment to any of the picture. I'll be able to see that. Well, thank you so much. That's very sweet of you for saying it, Meghna. Also, I want to tell everyone, I want to wish everyone a happy new year. and hopefully you had a Merry Christmas. There are news about a new strain, a mutant strain of the current virus in our country as well. So I know it's very easy to get carried away because it's New Year's Eve and things like that. But please be very, very, very careful. Try not to go for the group gatherings. Do your own little with your family members and try to stay safe because that is important. And next year, we'll be in a better place for sure if we are careful from now. So on that note, I want to end the live and also wishing you all a very, very happy new year ahead. And I hope 2020 taught us a lot of things. At least it did for me. And I don't think it's a terrible year. It is a good year. It's all about our perspective. Thank you. Thank you.